patient ratio, the staff, the manager, just the autonomy they give you and let you actually do your nursing. It wasn't stressful. Yes, the patients, I had, complicated patients. But overall, it was manageable. I could manage my workload. And that's what I liked about it. Like, it was real definition to me of what I thought my nursing experience should have been. You ask for any kind of help, all the nurses, you got some nurses, they gonna act the way they act. But for the most part, if you needed help, everybody was willing to help, even other, because it was a lot of travel nurses there at the time. But even the other travel nurses, they were willing to help. And let me see what else. What kind of patients did we? It's med-surg, so you get all type of patients. But we used to get a lot of insulin drips, a lot of heparin drips. Let's see, a lot of stroke patients, because that was one of the things that floor, I get specialized in. So we used to get a lot of stroke patients, a lot of patients with diseases that I only, learn about in the book, like those rare diseases. So I got a chance to experience stuff like that. And the nurses I work with, we used to go out to breakfast and just try to build some type of bond together. Everybody was really cool. I really enjoyed that environment. It was a good stress-free environment. I did used to get pulled sometimes, but not that much. And then when you did get pulled, I used to always get pulled to I don't know, I guess the 8th floor or something. But it was kind of a floor like I worked on, another med-surg floor. But I used to always be full there, and the most patients I used to have up there was 5. That floor was kind of I would say a little bit rougher than the one I worked on. What else I want to say about that hospital? Just the doctors. Yes, the doctors, because it was also it was a teacher hospital. So a lot of the residents used to deal with a lot of them. What else? The doctors were cool. They were chill. Never had a problem. Hold on, let me rewind. I did have a problem with one doctor. She got mad I gave the patient some Narcan, but the patient needed the Narcan, and I didn't care what she was talking about. So, yeah, I mean, you're going to encounter situations like that throughout nursing, but it is what it is. As long as you're trying to make that right decision, that safe decision. I wouldn't necessarily say right, but that safe decision that's appropriate for the patient, you usually come out on top.